Hi, everyone. Welcome to DHEC's January 20th media briefing on COVID-19 vaccine in South Carolina. Again, I'm Christy Moore, DHEC Chief Communications Officer, and I'll be facilitating today's briefing with Dr. Brandon Traxler, DHEC Interim Public Health Director, and Stephen White, DHEC Immunizations Director, has also joined to help assist with questions. We appreciate your dedication to share timely and accurate information with fellow South Carolinians. Dr. Traxler will provide an update, and then we'll move into facilitated questions and answers. And if there's time, I will open it up for questions. And if you can raise your hand, I will call on folks, hopefully in the order in which those hands were raised. Would like to remind everyone to please remain muted so that we can get a good quality recording today. We make these available online at scdhec.gov/vax, V-A-X, F-A-C-T-S, about a couple hours after these briefings. With that, I'm going to turn over to Dr. Traxler for today's update.
Thank you, Christy. Good afternoon, everyone. So I'm just going to give a brief update today. We'll keep it short so that we can answer as many questions as possible. I wanted to talk about our efforts to accelerate the vaccine administration and our recommendations for how providers can quickly across the state get shots into arms. States across the country are working different ways to address the challenges of promoting the vaccine and having people schedule appointments while there is still such a very small amount of the vaccine available. South Carolina continues to receive about 63,000 doses of vaccine each week, with about equal parts of Pfizer and Moderna. And those are those are the first doses, sorry. We don't anticipate receiving more than that on a weekly basis anytime soon. We continue to have more appointments scheduled than we currently have doses available as the demand continues to outweigh supply. We understand that it is hard to be patient and wait for appointments that may not be scheduled for several weeks out, but we also are very encouraged by South Carolinians who, and how many of them are doing the right thing by making their spot in line to receive the vaccine. Over the weekend, we sent updated guidance to our state's vaccine providers that outlines the methods for ensuring as many people are vaccinated as quickly as possible. This guidance document is available on our vaccine provider website, but I wanted to go over some of the key points that are within that document that will help ensure that providers are putting every last drop of vaccine that comes into South Carolina into the arms of these phase 1A individuals. No doses should be held back for second doses. We want every vial that a facility receives being actively used to fulfill appointment requests. We want providers to only order the number of doses that they know that they have the capacity to administer the following week. Over ordering can lead to vials sitting on shelves, and that's the last thing that we want. We want every vial, every dose in every vial that comes into our state being administered as quickly as possible. So we're encouraging them to take advantage of the extra doses. Many of the Pfizer vials can provide a sixth and sometimes even seventh dose, and some Moderna vials contain an extra 11th dose. Every drop of these vaccines should be used properly to vaccinate South Carolinians. Until the vaccines are more widely available, clinics should be by appointment only. This avoids long lines and crowds, which could contribute to disease spread, and helps manage our residents' expectations. There isn't enough vaccine available to accommodate unscheduled walk-ins everywhere. We've already seen this create confusion and frustration. Providers should be ordering their second doses separately from their first doses and in the same amount to match their first dose orders. This is how they'll manage having enough doses to complete that required second dose for everyone scheduling appointments. In addition to these recommendations, which are on our website, we're continuing to make progress on two fronts. One, we're developing a new public call center for vaccine information only. Our care line, with the support of the PEPS line, has done a tremendous job responding to the thousands and thousands of calls every day from the public. However, the Caroline is still up and running for non-COVID related calls. It provides other DHEC services as well. By establishing a new vaccine-only call center, we'll be able to separate out the vaccine calls from our non-vaccine calls as a way to continue to be responsive to public requests as fast as humanly possible. We hope to have this new call center live in the coming days, and we'll provide more information once it's operational. Secondly, our IT team continues to make great strides in the development of a one-stop shop appointment scheduling program for COVID-19 vaccines in the state. This is being developed to make scheduling appointments more streamlined and easier for, especially for older populations or those even without internet or computer access. We'll continue to provide an update on this scheduler as its development is complete in the coming days. And with that, I think we'll go ahead and turn it over to questions. Thank you. Christy?
So Dr. Traxler, can you provide an update on the discrepancy between the information reported by DHEC and the information listed for South Carolina on the CDC's vaccine tracker? Is the state being shortchanged on doses? And what are we doing to fix this and bring more doses into our state?
Sure. So after doing a thorough review of the CDC's vaccine data tracker, DHEC, the CDC, and Operation Warp Speed all agree that South Carolina is receiving its fair and appropriate allocation. It's important to understand that the reason why our allocations currently appear lower is because the doses distributed category on that vaccine data tracker only includes the doses that have been shipped to states and to the pharmacies through the Federal Pharmacy Partnership for long-term care facilities, for nursing homes and assisted livings, and not those doses that have been allocated or promised to the long-term care facility program by the state that have been reallocated to that program. Unlike many states, South Carolina immediately allocated to the long-term care facility program the entire amount of doses that were going to be needed to ensure that every resident and staff member of the long-term care facilities in the state were able to receive both doses of the vaccine. And meanwhile, a lot of other states instead chose to allocate their doses to that program on kind of a continuous, ongoing, as needed basis. And for that reason, those states have had more doses shipped into their states to date. However, unlike South Carolina, those states will need to continue to send doses to that program and those pharmacies in that program for several more weeks at least, which decreases on an ongoing basis than the number of vaccines that they have available for other vaccine providers in the state. There are about 750 long-term care facilities in the state, 193 skilled nursing facilities, 491 community residential care facilities, which are assisted livings, and 66 intermediate care facilities. And those are being covered by the combined efforts of this long-term care federal pharmacy partnership, some state and local pharmacy partners, and the federal retail pharmacy partnership. 81% roughly of the state's skilled nursing facilities or nursing homes had their initial vaccination clinic completed. And that's 157 out of 193, and this is as of the beginning of this week. Well, about 43% of the assisted livings have had their initial vaccination clinic completed. That was about 214 out of the 491. And the intermediate care facilities are projected to be vaccinated between now and the end of the month for their first clinic via the retail pharmacy partnership. The pharmacies are having trouble reaching a handful of the facilities to set up their clinics. DHEC's helping them to reach out to those administrators. And there have been at least one program where they've had to postpone their first clinic due to an active COVID outbreak. But except for those handful of facilities, all the nursing homes and assisted livings are scheduled for their first clinic on or before the end of this month, I believe January 28th. And so we are continuing to monitor that South Carolina receives every dose of vaccine allocated to the state, but are confident that we are receiving it at this time.
Has South Carolina been ordering the total amount of doses each week since vaccine first became available?
We have been ordering the first dose allocations. We have a zero balance from with the federal government for first doses, and we have a very limited number of second doses. And of course, that second dose utilization does lag either 3 or 4 weeks, depending on the type, behind the first doses.
What is DHEC's current assessment of where the lag is in vaccine distribution in the state? Is it hospitals? Is it staffing? Can you explain this, please?
So there have been instances where there has been a vaccine that has not been getting into arms immediately, and there has been miscommunications, misunderstandings between the pharmacies. Not the pharmacies, the hospitals at times. Those have all been clarified. We are now seeing every dose get rapidly taken up. And so with clarification and the additional guidance we put out this weekend, so I am confident that the vaccine utilization has really taken off at this point.
How do hospitals place orders for vaccine? On what day and at what time do they learn? And does the state learn of its dose allocation for the next week for both Pfizer and Moderna?
Stephen, are you on?
Yeah, I'm here. I can take that question. So we do ask the hospitals to place their orders in VAMS by Tuesday at noon. That is the request. And we typically learn on Tuesday, earlier in the week, we anticipate what we're going to get. On Tuesdays, we find out what those allocation numbers are going to be. And usually by the end of the week, Thursday, Friday, we are able to notify the hospitals of what they're going to receive and when they're going to get it, which is typically for the hospital systems, that's going to be the following week if it's Pfizer product, and the Moderna product we have seen come as early as the same week, but we are also anticipating that could come as early as that following Monday as well. And that information, there is guidance, I believe, that has gone out that can be found on the DHEC website as well.
And how has the storage of doses impacted the estimated timetable for phases?
How has the storage?
The shortage of doses? Yeah.
Okay.
The estimated timetable for phases.
Certainly. So when we're looking at the phases, we're looking at several different factors. One of them is the availability of the vaccine, how much is coming into the state. The other is the utilization in terms of how many people are willing to get vaccinated and are getting vaccinated. And then, of course, the sizes of each phase's population. At this time, we anticipate that our allocation, basically from the federal government, will remain the same for the foreseeable future. But we are hopeful that in the not too distant future, there will be additional vaccines coming on board and/or increases in the production and allocation. So at this time, we have not made any substantial changes to that estimated timeline.
We're hearing that some people aren't able to schedule their second appointment within the 21 or 28-day time frame. What does that mean? And secondly, will they still be considered fully vaccinated and protected if their appointment isn't until the recommended time frame?
Certainly. So we do encourage everyone, and we've reminded our vaccine providers of this, to please schedule your second dose no later than when you're getting your first dose. So if you're getting your first dose and you don't have that second appointment scheduled, please ask. And if you have already gotten your first dose and don't have that second dose, then please reach out to where the provider that gave you your first dose to get scheduled if there are not appointments available in VAMS. You can get the second dose anywhere from 4 days before that recommended interval. So either 17 days would be the minimum days that had passed since your Pfizer first dose. It'll be 24 days for your Moderna, since your Moderna first dose. There is not at this time a known cap basically on when you can get that second dose. But we do strongly recommend that everyone get it as close as they can to that 21 or 28 days, and really recommend and that people go and get it within certainly a week at most two of that point.
What's the time frame for additional types or brands of vaccine receiving an emergency use authorization and being authorized for the public?
So I don't have an estimated more precise date, but I have heard that in the next couple or few months we should be seeing additional vaccines come on board. We will find out when everyone does, when the Independent Safety and Data Monitoring Board allows the pharmaceutical company to apply for their emergency use authorization. So that is when the point in time in which they can do it, and we'll find out when everyone else does then too.
We have received complaints, many from people who are elderly or high risk. They have upcoming appointments, but are very frustrated and upset because people who did not follow the rules could get ahead of them in line at the pilot clinic last week. Everyone understands not wanting to turn anyone away during a pandemic, but fairness and transparency are critical to public trust. What do you say to those who now doubt the fairness of the vaccine administration process?
So, I say that we do hear you. As we've noted before, we learned and are making improvements on our logistics after having held that pilot clinic, so that we can improve for future clinics. And one thing that we did learn and that we really do encourage is using appointments and having appointment only clinics. That's something we're strongly encouraging at this point to prevent people having to wait in long lines, and certainly if it was a walk-up event, certainly prevent any kind of disease spread. So I say that we hear you, and as that was the purpose of the pilot, was to test it and see how it went, and we learned lessons from it, and that we will do everything we can not to make again.
How far along are we in phase 1A? What percentage of phase 1A recipients or percentage of 1A healthcare workers have been vaccinated?
Sure. So I think 1A, we have the estimates for the populations for phase 1A on the DHEC website. And that, when you look then at the numbers of how many people have been vaccinated, you can see the proportion of people in 1A who have been. I do not know, and I don't know, Stephen, do you know off the top of your head the percentage or proportion of healthcare workers? If not, we can see if we have that information and try to get it back to them.
Yeah, we can work to provide that. I don't have that on hand at the moment.
Data shown in a recent presentation said there have been 24,992 canceled appointments. Can you share the breakdown of the reasons for the cancellations, and are cancellations slowing down the vaccine rollout?
I think I can take that one, Christy. So, we are continuing to work with the VAMS team at the CDC on, because we are aware that there have been some scheduled appointments that have inadvertently canceled, and so we're working with them to figure out what the reasons are behind some of those issues. But we have seen appointments that cancel, just like in any scheduler that you would see at a usual doctor's office, where appointments need to be canceled due to scheduling conflicts or there's a no-show at an event. But while we understand that there are scheduling conflicts and no-shows, and that certainly does contribute to the overall mission of getting vaccines into arms. But a lot of these facilities and hospitals are also working to fill appointments as quickly as they're able to do so. And so we anticipate that will continue to go on as the demand is very high, and we'll continue to be able to fill appointment slots as necessary.
And we do remind everyone that if they reschedule, if they make an appointment somewhere for a different time, to please go ahead and then immediately cancel that one that you'd initially made, so that they can refill that very quickly, because they are doing a great job of that.
Thank you both. How are DHEC individual providers ensuring there is an adequate supply of second round doses now that the federal government is no longer holding doses back?
So we are still able to order second doses through our second dose allocation, which is a separate allocation that we receive where they have those. So we have not been advised, at least I'm not aware, and I don't think Stephen is, he can confirm, of anything differently. And we still are continuing to receive those second doses from the federal government. So we're asking providers to continue to order them the same way, separately from their first doses as we've been reminding them.
What will mobile vaccine efforts look like in the state, particularly in rural communities?
Certainly. So that is also going to partially depend on the vaccine that we're talking about, if new vaccines potentially become available. But based on what's available right now, we know that there are going to be time constraints potentially to holding clinics in areas with using mobile storage. The Pfizer can only be at room temperature for 6 hours. Thankfully, Moderna can be at room temperature for 12 hours. So we certainly, will likely be using the Moderna vaccine for all of our mobile clinics, and working with our local community partners in some of these rural areas to hold vaccine clinics. And also another important thing that we'll be doing is making sure that then the people in those communities are able to get their second doses in the right time frame.
Have the variants been identified in the state, and how is the state tracking those variants?
And for this, we're talking, I assume, about the genetic variants.
That's correct.
Okay, sorry, we just deviated from vaccines a little bit there. So we are currently have no known cases of the virus variants in the state. We would publicly announce it via a news release if we were to become aware of a reported case that was identified as one. Our public health laboratory has been doing the genetic sequencing for the SARS-CoV-2 virus, which causes COVID-19, since June. We are performing sequencing on 24 samples a week. And we are also in the process of reviewing all of the positives from December through the present for samples that were negative for that S gene, which is the one of the genes that's missing, one of the key ones that's missing from that variant. And we're sharing information then on these samples that we have with the CDC.
Why aren't immediate family members of essential workers included in one of the early vaccine phases?
So while we have very limited doses, we have to be very careful with the phased rollout of it. And so we are looking to the Centers for Disease Control and Prevention, the Advisory Committee on Immunization Practices, the CDC, ACIP, their recommendations, as well as those from our own South Carolina COVID-19 Vaccine Advisory Committee, and in terms of who they recommend in each phase. And at this time, with limited doses, the priority when we are at frontline or essential workers is going to be vaccinating those workers themselves.
Thank you, Dr. Traxler, and thank you as well, Stephen, for helping to answer those questions. So that was the end of the questions that were submitted. So we do have about 5 minutes left over. Morgan Newell, I saw your hand go up first. Please ask your question.
Hey, I had a question, kind of a two-parter, if you will, about DHEC's all call to the nurses. I know you guys really wanted a lot of positions filled at 150. Can you tell me how many positions have already been filled so far? And we've also had some complaints from retired nurses, particularly that older community who is struggling to go through an entire application process and believes it should be shorter given the fact that you guys want to fill these positions so quickly. So can you talk a little bit about that as well?
Sure, and we'll have to get back to you for how many positions have been filled. I don't have that number off the top of my head, I'm sorry. In terms of the application process, we do appreciate, that it can be, a lot of work, but we also do need to make certain that people we are hiring have the right skills for the job, and that that they are appropriately trained, such as retired nurses, making sure that they have had nursing experience and have their nursing license and such, and also want to make certain that we are hiring on the people that we need. And if people don't want to go through the application process to be hired, one other thing that we do have is the volunteer option, especially for people, maybe for retired nurses. If they're willing to volunteer, then I would encourage them. I believe our website for it just went live just earlier today, and right, Christy? And where people can fill out the form if they want to volunteer.
Yeah, Dr. Traxler, that's correct. Morgan, I have written down your questions about the number of positions that have been filled, and we'll make sure we get that information to you. And I'll also make sure that I send you the link to those volunteers. So it's medical volunteers and also administrative personnel that our vaccine providers could be looking for.
Perfect.
Judy,
Thank you.
You're so welcome. Judy Gatson, you had a question?
Good morning, everybody, or good afternoon. I guess my days are running together. Dr. Traxler, can you talk a little bit? I know you already addressed this in some fashion, talking about not encouraging walk-up clinics, which I believe they're planning to do in Orangeburg, according to our reporting yesterday, to kind of expedite the process. But with the pilot clinic last week and the people who walked up and they were able to be registered on the spot, the question I'm getting from viewers is when they're sending or registering and sending that information to VAMS, sometimes it's taking them days to hear from the CDC. So do you have any insight, knowing that it was able to be done on the spot versus why it might take longer for some people to hear back?
I don't. It is usually fairly quick once your name and email address are uploaded to VAMS. So I don't know if these folks are, maybe when it's taking longer, if it's that they're submitting their name to a different organization that's then having to input it into VAMS. But regardless, one thing is that scheduling appointments will be much easier with our new scheduling system that we're going to be rolling out here very soon. It won't require waiting for that email back from VAMS.
Thank you, Dr. Traxler and Judy. Vanessa, you had a question?
Thank you. I just wanted to circle back. This is probably just going to be a short answer, but if you could just touch back on the fully vaccinated question that another reporter had. I just was curious, would you then be considered fully vaccinated as long as you got your second dose? Even if you weren't given that second dose, then I guess would be the required or recommended period of time?
I'm sorry, I was having a little bit of trouble hearing you. I think you were asking about the second dose and were you asking the time frame during which you can get it?
Yeah. I wanted to clarify your answer to that previous question about getting that second dose. But, if somebody doesn't get it within the recommended period of time, would you be considered fully vaccinated just as long as you got it?
Yes, you would be fully vaccinated as long as you got that second dose. However, with such small numbers of vaccines coming in, and with really encouraging providers to not store vaccines on their shelves, we really need everyone to go ahead and get their second dose when it's time, so that they can be certain that that second dose is there and available for them, but also then not have vaccines sitting on shelves. We need to be getting it into everybody's arms and getting everybody fully immunized as fast as possible within the recommendations.
Chris at WIS, you have a question? Chris, are you there? Do you have a question? Sophia, do you have a question for Dr. Traxler or Stephen White?
Hi, yes. So our station has gotten a lot of calls from this elder generation talking about, staying on the phone for hours, not being able to get in touch with DHEC about appointments. Also, you know, a lot of them aren't computer savvy. And so, you know, on y'all's and what is being done, what would you advise this group of people in the 1A phase who is having a hard time scheduling an appointment? What would you tell them?
Sure. So as I noted in my opening comments, we have a new call center that's going to be opening, that's going to be dedicated to vaccines. And so that will hopefully shorten wait times and make it easier for folks to call. In addition, when that and then the scheduling site, basically scheduling program goes live, we'll be able to help people make appointments. So, you know, people who don't use the internet or the computer will have an option as well.
And I'm going to try one more. Thank you, Sophia. I didn't mean to talk over you. Chris, can you unmute your mic and ask your question?
Is it right?
Chris, I think you're having technical difficulties. I'm so sorry about that. Just go ahead and email us if you've got a question.
You hear me now, Dr. Traxler?
Yes.
Okay, good. Thank you. So earlier you talked about how the CDC data may not reflect the reality of the situation. Dr. Linda Bell mentioned that perhaps age was a factor in those populations in the vaccine committee. Can you speak a little bit more about what the CDC communicated to you about maybe that discrepancy?
Sure. And so I suspect, I don't know for certain, but I suspect what Dr. Bell was referring to was the age of the data. And so that is also one factor, is when their data, you know, can be a day or two behind because they are pulling it separately, and I think in many cases, you know, working with states to verify it. So so what we're seeing is that that doses distributed is just not fully representing all the doses that South Carolina has available to utilize. We have allocated doses that are not included in that number to the pharmacies to use in nursing homes and assisted living facilities to make certain that they have both the first and second doses for all those people.
Thank you, Dr. Traxler. At this time, we're just a few minutes over, so just would like to thank Dr. Traxler and Stephen White for continuing to carve out time in their schedules to hold these important updates. I'd also like to thank the reporters for your participation in submitting those thoughtful questions. We hope the answers provided today by our experts will help you keep everyone better informed about COVID-19 vaccine and the state's vaccine rollout. We will continue this ongoing conversation later this week. This concludes our briefing. Thank you.